Hello everyone. Today we will be discussing regarding cerebrospinal fluid circulation and hydrocephalus in newborn. The cerebrospinal fluid is usually surrounded in the brain and spinal cord. There, they act as a cushion, nutrient medium, and also as a waste remover. Disturbance in the cerebrospinal fluid dynamics usually result in hydrocephalus. Especially, this is very dangerous in newborns, also sometimes life-threatening. So, what is a CSF? So, CSF is a clear, colorless, watery fluid. The total volume is around 150 ml in adults and 40 to 60 ml in newborns. It is produced mainly by choroid plexus in the and 80% of CSF are produced by this choroid plexus and the production rate is 500 ml per day. So usually every single day CSF is reproduced 3 to 4 times a day. So this is how a normal CSF will look like. So what is the composition of CSF? 60 to 70% will consist of blood glucose, then 15 to 45 milligram of protein per deciliter. They are normally acellular. pH is about 7.3 with a specific gravity of 1.05. Coming to the ventricular system of brain. The ventricular system consists of lateral ventricle, third ventricle, fourth ventricle. Then ependymal linings forms the boundary. The choroid plexus within the ventricles secretes 80% of CSF. Now, how this is circulated? So, the CSF that are produced in the lateral ventricles enter through the foramen of Monro and then enters through the third ventricle. From there, through aqueduct of Cilius, they enter into the fourth ventricle. From there, they enter through foramen of Lashka-Narendi and enter through subarachnoid space, then arachnoid villi, and then venous sinuses. They are then reabsorbed. So the CSF is basically secreted in the choroid plexus. Okay. From choroid plexus in the lateral ventricle. From the lateral ventricle through the foramen of Monro, they enters the third ventricle. From third ventricle through the foramen through the aqueduct of Cilius enters the fourth ventricle. And from there they enter through the foramen of Lashka and Negandi subarachnoid space, and then it enters into arachnoid gangulations and then venous sinus durometer. This is how CSF is produced. Choroid plexus, CSF then pass through third ventricle, then pass through fourth ventricle, then pass through subarachnoid space, and then enters into here of here. So arterial pulsations of choroid plexus produces it, and the pressure gradient between ventricles and venous sinuses, ciliary motion of the ependymal cells, postural and respiratory variations regulate the flow of CSF. So the functions include mechanical cushion, that is protecting the brain, buoyancy, reduces brain weight, nutrient transport, chemical stability. Hydrocephalus definition. So when there is an abnormal accumulation of CSF within the ventricles, it results in raised intracranial pressure, and in newborns it will result in head enlargement due to open sutures. CSF is basically classified into non-communicating, that is obstructed thing communicating. There will be normal flow but a poor absorption or increase in production. So then again it can be classified into congenital and acquired forms. There is another forms which are not basically recognized, which is called hydrocephalus ex vacuum. Ex vacuo, because in here there is no issue with the CSF per se, but because of cortical atrophy, the remaining space is occupied by the cerebrospinal fluid. Then normal pressure hydrocephalus, which is typically occurred in adult, which typically occurs in adults, the cause of which is largely unknown. So coming to congenital causes, aqueductal stenosis, Dandy Walker malformation, Arnold Chiari malformation, and torch infections. In case of acquired, it can be due to IVH, post-meningitis tumor, to fibrosis or tumors. Pathophysiology. So there is an imbalance between production and absorption, leads to ventricular dilation, cortical thinning, and brain compression. So open sutures in infants permit the head expansion. So coming to the clinical features in newborn, there will be head enlargement, bulging fontanelle, wide sutures, dilated scalp veins, frontal bossing, settling sun sign. Then there will be irritability, vomiting, and a developmental delay will result in. So in case of older children, there will be brief shrill or high-pitched cry, changes in personality, memory, changes in facial appearance, uncontrolled eye movements, difficulty in feeling, excessive sleepiness, headaches will be there. Then there will be irritability, poor temper control, then loss of bladder control, loss of coordination or trouble walking, then muscle spasticity, and there will be a slow growth or slow or restricted movement and vomiting. So this is what a normal thing will look like. There is no hydrocephalus. When there is a hydrocephalus, as you can see, there will be narrow sulci, flattened gyri, enlarged ventricles, and enlarged head. So this is you can see settling sun sign. You can see in this unfortunate kid settling sun sign, frontal bossing, and then dilated veins. Diagnostic evaluation with circumferences monitoring, which results usually in more than 97th percentile. Then cranial ultrasound, CT in case of emergency, and MRI is a definitive diagnosis. Torch testing for congenital causes. So the coming to the management, azithromycin or furosemide in case of slow growing hydrocephalus, and surgical is the definitive treatment for emergency procedures where there will be ventriculoperitoneal shunt or endoscopic third ventriculostomy can be done. At the MBBS level, just knowing this shunt procedure's name is sufficient enough. Prognosis and follow-up. So if there is an early treatment, there will be a good outcome. Untreated cases, there will be cortical thinning, blindness, and developmental delay, and lifelong follow-up for shunt functioning. So prevention, folic acid supplementation can prevent spina bifida, which is one of the causes of hydrocephalus. Antenatal ultrasound, maternal infection control, and safe neonatal handling. To summarize, CSF is mainly produced in choroid plexus. The flow is from lateral ventricle to third to fourth ventricle to subarachnoid space. Any pathway, any obstruction in this pathway can result in hydrocephalus, or any issue with result to absorption or increased production. Arachnoid villi or venous cephalus can also result in hydrocephalus. So commonest cause is aqueductal stenosis in newborn. The take-home message is the CSF is a vital balance. Hydrocephalus actually an imbalance which will cause brain compression. The early diagnosis and the surgery actually saves life. Okay, hope you have learned. Thank you.